Great innovation stories make change possible. Each week on the Innovation Storytellers podcast, I invite innovation leaders to share how they overcame the obstacles to introduce breakthrough ideas to the world through the power of story. I'm featuring guests from Tesla, TD Ameritrade, Corning, Cisco, Bloomberg, and so many more. Listen in to learn how you can tell a more effective innovation story and change the future for the better. Hi, everybody, and welcome back to Innovation Storytellers. I'm your host, Susan Lindner. And for the last 20 years, I've been working with innovators from around the globe, trying to nail down these stories of how innovation gets done in large companies, and sometimes the outside voices and inside voices that help or hinder the process. I'm really excited to have with me today Eric Fennel, who is the Vice President of National Network Strategy, Innovation and Value-Based Solutions at Aetna, a CVS health company. Eric has also been a phenomenal leader across both entrepreneurial and corporate histories, having started his own consulting firm, having run these value-based care solutions at places like Evolent Health, and also working at the Center for Medicare and Medicaid Innovation, not to mention another small mom and pop company like Wellpoint. So Eric brings this tremendous level of startup and grown-up expertise when it comes to innovation. And today we're going to have a very spirited conversation around not just innovation, but how it actually gets done, and perhaps even how we make this transition from entrepreneur to intrapreneur and really trying to change the inner workings of some of the biggest companies in the country. So Eric, welcome to Innovation Storytellers.
Thank you. I am absolutely thrilled to be here today. So cannot wait for the conversation.
Well, I suppose we should let our listeners know that you and I know each other beyond innovation circles. We also went to Dickinson College together, graduating in the year. So
yeah, exactly. That's probably an important disclaimer before old stories and inside jokes surface during the course of the conversation.
That's right. That's right. So we'll try to keep those to a minimum unless we decide to let the audience in on some of those. But I think it's hysterical that you and I are both come from a small liberal arts college like Dickinson College. We both wound up taking very different paths, but found our way to innovation, like at the innovation door so many times in our careers. And you probably wouldn't have thought that from a humanities-based education. But I think it's served both of us really well to look at innovation in a way that's not scientific or necessarily particularly futuristic, but rather just having a really great imagination behind what we do, an interdisciplinary imagination to create innovation.
Absolutely.
Yeah. So let's start there, Eric. How did you even come to knock on the innovation door?
Yeah, I mean, it certainly wasn't by design. I think I very literally wandered into it, and it started early in my career, the windy road to get there. You know, my first 6 or 7 years, I was with a very mission-oriented, not-for-profit healthcare organization that also happened to be a startup. And so a lot of the work was, really thinking about how to develop products and services and find markets for those products and services, the things the organization thought they could bring to the world. But I didn't really think about that as innovation work. At some point, I had a chance to jump out of healthcare into what was at the time an old line publishing company that was trying to move from print-based publishing to online subscription-based content model, really in the process completely inverting their business model and disrupting themselves. It was 1999. That was the thing to do at the time. The internet was sort of becoming the focal point of everybody's business model retooling. But even though that's what we were doing, I still at that point, I don't think I thought of myself as doing innovation work. But from there, it's where I wandered into my first venture-funded startup. In that product, or in that company, what we were trying to do was to disrupt the health insurance market, to really flip the business model on its head with a different financial model and a fundamentally different consumer experience. And, obviously, that being a relatively entrenched market, there was a lot we had to do to convince people that what we were doing made sense. And I think that's when I first really started to think of myself as actually in the business of innovation. Yeah. And I began really exploring innovation concepts and frameworks and things that would be helpful to us in trying to explain not only why we needed to change the model, but the way in which we are trying to change it in a way that connected.
That realization is when you hit that stride in your career, right? So you're 10 years out of college and you're going, oh, I'm starting to get a feel for something that feels right here.
Yeah.
And it's time to make a switch. And you still feel emboldened, right? That you can look at a company and go, I'd like to take this business model and turn the ice cream cone upside down and see if we could still suck the revenue out of it, so to speak. So like, could we actually make it better than, more profitable than, easier to use than? Was that what was driving your thinking?
Yeah, absolutely. I mean, we were looking at the health insurance sort of product space as it existed. And our fundamental belief was that there was a way to reinvent it that created a much different and a better experience for consumers, and also a way that realigned the financial incentives to help support people in making decisions about their own care. And so there was just this belief that there was a better way to do things. And there are many people I'm sure you've run across that feel like there's a better way to do various things in healthcare. That was driving us at the time. And we looked at the players that existed, and it was the classic innovator's dilemma. They were not set up to disrupt themselves. And so we felt, I think, very much emboldened to come from the outside and bring a new way of doing things. That doesn't mean it was easy. We were up against a lot of just entrenched interest, against a way a product had been presented in the world for a long, long time. But I think to your point, we felt very much emboldened that we knew there was a better way to do it. We wanted to try.
So can you share with us the company name?
Yeah, the company was called Luminos and was ultimately acquired by Wellpoint. This is back in the early 2000s.
Yeah. So walk us through just a little bit that innovation when you're looking at a business model and you go, this doesn't serve us anymore. Let's flip it on its head. What's the story that you first start off telling about things got to change? There's a better way to do this. How does it start?
Sure. So the product was, Luminos worked primarily with large employers.
Yeah.
And when it comes to health benefits for their employees, large employers are essentially the health plan. And they hire a payer to come in and actually administer that plan, administer the benefits. So that's the space in which we were competing. And what we thought we could drive is a product that would create for an employer's employees, a product that would be more satisfying for them, provide better service to them, through a differentiated consumer experience. But also by really wrapping around the consumer, that we could have a way to engage people in their health earlier in the process and drive better clinical outcomes. And for the employer who's paying the bills at the end of the day, to drive a more manageable cost structure in the long term. A lot of the market at the time was oriented around these hard levers of driving costs. And we thought there was a way to attack the problem differently through improving health, more so than just controlling the levers on cost and utilization.
Wait a minute. A health insurance company that's focused on your health? That's a business model shift.
Yeah.
Who'd have thunk? You might want to start there.
If I remember correctly, one of our taglines was the healthier health plan. That was really where we were focused.
Nice. So the story that you're telling is we actually start from your employees' health rather than your insurance.
Yeah, absolutely.
Wow.
And so that was the journey we were on for a couple of years. We got acquired by Wellpoint, and we stayed on that journey as part of Wellpoint when they were seeing the value in the model. And other large payers, national payers, were doing the same. There were other competitors of ours who were acquired. The model itself started to gain some traction. And then there was a point at which, when you get acquired by a large company, you start to absorb in. And there was an opportunity for, having recognized what we were able to do, we were actually, a handful of us were asked to stand up inside of Wellpoint a corporate or an enterprise level innovation team. And so that was actually my first actual innovation job by title, because the goal there was to create the ability inside of Wellpoint to create more products and services like that.
So does that mean Wellpoint didn't have an established innovation team before they acquired your business?
I think, if I recall correctly, there was innovation happening across the organization in pockets. But just to put it in context, Wellpoint was itself built through a number of acquisitions. So I would not be so presumptive to say there weren't innovation teams. I think they were just distributed in the local plans. I think our coming together was really in line with Anthem and Wellpoint had just come together. And so the organization itself was still forming at an enterprise level. And it was just, the timing was right to try to set something up at an enterprise level to support the local markets.
Got you. So this is such a rarity, right? That a large company acquires a startup and says, you guys are doing such a great job. We want you to run the innovation department for the company, after it's just merged with like the two massive powerhouses, right? And they're, kudos to them. They're thinking about the future in the midst of really working on a very enterprising present.
Yeah, it was a fascinating opportunity and, daunting to think about. The company we're coming from had grown from a startup to maybe 300 or so employees. And then the next day you're part of 40,000 employees
Oof,
and you're thinking
right.
about how do I take what we've learned and help engage and support the rest of this large organization and really moving new concepts forward. So more than a little energizing, more than a little daunting all at the same time.
Yeah. So you're a new group inside of a huge company, 40,000 people, you said. How do you get, as we talk a lot about on here, the resources, the runway, the time frame, right? And the recognition you deserve for the work that you're doing. And what were some of those products that you decided to put forth?
I think the thing that was really different going from the startup to that environment, what we had to recognize to get traction was when I think about the work at Luminos, I was really thinking about innovation at, for lack of a better expression, really at the organism level, right? The whole company, the whole business offering. That was really our focus: is how do we create this whole thing that's differentiated from this other? I think what I didn't appreciate, but it's interesting to look back in hindsight, is that within that whole, there were dozens of things we did that by themselves were innovations, right? That they were new ways of looking at the financial model or the customer experience or the technology was another piece of it. And so that was an important learning because as we went into the large company and we thought about orienting our model for innovation, what I realized is we had to start innovating at the molecular level because our charge was different. Our charge was not to innovate, sort of reinvent the entire business model. It was to find ways to accelerate our ability to differentiate, to create new products and services, to do things a little bit more discreetly that would really move the business forward. So we really had to change our thinking. I had to change my thinking from that sort of looking at the whole to looking at all the individual problems that were out there to solve and how could we create solutions to those problems. And that was really the foundation of what we put forward the organization is to say, we're going to orient around solving enough discrete problems that will create differentiation, revenue, and new market opportunities. And that was how we sort of built the basis for what we wanted to accomplish.
So you're going from having a beautifully baked loaf of bread and going, now we're going to bring the innovation, find out just how to slice it. We're not here to change the bread. We're here to make it more accessible, usable, profitable, etc.
Yeah. It was a pretty wide-ranging charter if you look at what we had the opportunity to look at. And it's why I think as we got into it, some concepts that really resonated with me were things like, and we actually had the opportunity to work with Clay Christensen and his firm at that time.
Wow.
And the concept of goals and bounds, really putting constraints around your innovation activities really made a lot of sense to be in that environment because we could go 1,000 different directions. And if we didn't have some focus on what we're trying to accomplish, that the risk of spending a lot of time going in all those different directions and accomplishing nothing was very real. So, we started to bring some tools in like the idea of goals and bounds and objective criteria to compare one idea to another idea, even though they might be very different. So we ended up with diversity of things we were working on, everything from, things that would create just a better customer experience to things that would create. I remember this one idea, and what I loved about it was it came up. We had set up a process internally to start to engage the whole organization as much as we could in the process of innovation and really start to surface ideas that might have been out there from people who are doing the work day to day. And I remember we got an idea from somebody who was working on the clinical, I think, nurse support line, in a local market and was talking to people about things they needed help with. And one of the things she said, she's like, we get all these requests for people who need to get DME, like crutches, walkers, things like that. And every time somebody has to get that, they're spending that money. She said, wouldn't it be great if we just had a closet of that stuff, the stuff that's reusable, and could just share it with people so they didn't have to pay for it? And so we ended up creating and testing essentially like a Craigslist for reusable DME as a support for members, right? A way to save them money and make it easier on them. So things like that. But then on the other end of the spectrum, we were looking at new payment models, whole new ways to pay for care that could translate into new products. So again, the range was quite broad, and it took an effort to kind of discipline ourselves to make sure that we wanted to keep a wide variety of things we were looking at. We wanted to make sure they all channeled into the organization's priorities and strategy.
So you come up with great ideas. I'm assuming this really helps generate more of an innovation culture in a place like Wellpoint too, when you're engaging more of the employees. But not every idea is a brilliant idea. They're all ideas, right? And everyone's got one.
Right.
I was listening to some other innovators talking about how open innovation contests can actually kill the morale of your employees if you don't do it right, because if you only pick 5 ideas, but you got 1,500 submitted, you're basically breaking the hearts of 1,494, 95 people rather, and maybe even seeing them disengage and get frustrated and resentful and things like that too. So some of these ideas will work great, some will not. So tell us about some of the flops that you've encountered in trying to push the innovation needle a little farther across the odometer, the speedometer.
One of the things we did that I think worked well, and this is a lesson I've carried forward with me to today, was we put a real emphasis on the beginning of the process and trying to make sure that we had a way to filter out the noise, essentially, to figure out which ideas had the most potential and the most promise, so that we didn't get to the end and invest all this time and money in an idea that wasn't going to go anywhere. We knew that we had to prove we were still proving the value of the whole innovation center. We couldn't risk that. And so we really put an emphasis on making sure that we got from idea to hypothesis before we took any other step. One of the things that we did there, it was a concept we borrowed from the advice we got from Insight and others at the time, was this concept of an idea resume. And this is still something I use today.
What is that?
It's a purposeful metaphor. If you've ever read a resume that's 7 pages long, you find yourself flipping through and say, all right, dude, what's your story? What are you trying to tell me? And all the idea resume is, think about just being forced to tell the story of your idea in 2 pages or less, and make sure you answer the critical questions that need to be answered each and every time we consider an idea. So what is the idea? What is the problem you're trying to solve? Who are you trying to solve it for? How do you think it could benefit the organization? How would you operationalize it? And I think very importantly, what are your assumptions and dependencies? Meaning, what has to come true for this thing to actually work the way I envision it? And we would force ourselves, our idea authors, to really hone in and tell that story in narrative and answer those questions. And we would debate that, we would iterate on it, and this was the other important part, we would time box that exercise so that we would spend, ideally no more than 30 to 45 days iterating through to get to a point where we had a solid hypothesis that we felt warranted further investment of time.
Okay.
And a principle that we try to use there was, it's a big organization. We have lots of data that in existing reports. We have lots of external relationships. We have lots of experts. So we wanted to use all that available stuff to help us develop and iterate through our hypothesis before, and I'm sure you've seen this, somebody gets a good idea. The next thing you know, he's commissioned a market study. You've engaged an external consultant, and you're 6 months in and you're still fishing for what the hypothesis is, which is not to say to discount the value in any way, shape, or form of doing external research or invention-focused activities. But in the context that we were operating in, we needed to be really focused and disciplined, and we didn't have finite resources to develop ideas or research ideas. So we really wanted to use that process to get through ideas effectively and efficiently. And the important output of that is be able to say no. Like, all right, here's a great idea, but like the underlying assumption of this great idea coming true is that CMS will make a regulatory change. That's not an easy assumption, right? We need to know that early on.
Right. So getting really clear about where the no's are, and then not being afraid to discard ideas because the time horizon's too long, or the time horizon or the regulatory environment isn't meshing up with where we need it to be at the moment. Stuff like that.
Yep, exactly. And that's where the goals and bounds came in, because the way we thought about it, and the way I still think about it, is you operate within a defined corporate strategy, right? You have you've got things the company wants to accomplish. You're always also living in some sort of real world constraints like budget, market pressures, other competitive dynamics. If you're not attentive to those things as you're developing the idea, you're going to run into them eventually. So what we did is to define those things, really what are the things that make the idea most attractive based on the context we're operating in right now? And what are the things that make the idea feasible for us, again, based on our current priorities and circumstances? And we would define those things out at a fairly granular level, and that would be the yardstick against which we measure the idea at every step of the process. Obviously, early on, you don't know as much, and so you're piling up those lists of assumptions and dependencies. But as you get further and further along in refining the idea, that's where you need to get more certainty about how that idea stacks up, or realize that you're not going to get there and you need to move on to the next one.
Yeah. And saying goodbye to some of those ideas that you might have told the CEO about already. Did it ever reach that level where, like, the thing we told you about, it's a giant flop and it definitely can't scale within the parameters that we need to make this process change?
Yeah, I remember back then I had an idea that I was absolutely enamored with, this idea of incentivizing people to be able to create a seamless incentive for people to purchase healthy foods. And we had talked about a potential partnership with an organization that was basically, it was already in the grocery stores and already in people's wallets. And how could we tap into that so that people could get rewarded for buying healthy foods by just doing what they do every day, just going to the store. It was an idea that had like such resonance with what we were trying to accomplish as an organization in that focus on consumer and consumer needs. But we ultimately, and we pitched it, and this is the lesson I learned, we pitched it all the way up. We had great support, and then we figured out we couldn't make the operating model work, and we couldn't make it work, within the budget we had, and that's where it had to go back on the table.
Hey, it's Susan here. Like what you're hearing so far? Make sure you never miss an episode by clicking the subscribe button now. This podcast is made possible by listeners like you. So thank you for being here. Whether it's your first time or you're 10 episodes deep, if you want to learn more about me and the work that I do with innovation leaders, head over to susanlindner.com for more information. I'm always open to a conversation to learn how I might better support you. But for right now, let's get back to the show. Yeah. So you're at Wellpoint for a while, and then you decide to move on from there as well. Tell us a little bit where you are today with Aetna CVS, about some of the innovations that you'd love to see happen or that you'd like to help make happen.
Yeah, I'm still relatively early in my journey at CVS. So I think, part of what I came into was a newly created function inside of our network organization. And just to provide sort of the picture, Aetna is the healthcare business unit within CVS. We provide insurance products and services to and benefit programs to approximately 40 million people across the country.
Wow.
And where I sit really within the Aetna division, and my primary focus is the network. And so in our business, the network it's the universe of healthcare providers that are providing healthcare services to your members. And within the network area, if you think about Aetna overall, so as part of CVS, CVS is a diversified consumer health company. And Aetna likewise is on that journey with them. So what we're trying to do, we believe we have this incredible opportunity to really rethink the way we look at the provider network as a consumer-focused company, as a consumer health company. In a traditional health insurance model, a health plan would look at the network, and it's really a network is a series of contracts with doctors and hospitals. You get your best price, you take it to market. The opportunity I think we have is to really look at it from the needs of the consumer and say, what are all the services that individual people, the human beings that we serve, what are the services that they need to maximize their health and wellness? And how do we work backwards from there to construct the network? And if you do that, I think you end up thinking differently about who are the types of providers that are in your network, what are the types of services that you're providing. Maybe they're both clinical and non-clinical, the things that really enable health, not just the delivery of healthcare. And you'd think differently about the way you'd support them. If your strategy is, as ours is, focused on delivering better outcomes for consumers, then you would think about how you support those providers in delivering those outcomes. And you start to think about the whole person. Maybe it's not just the doctor in the network that provides the care to the individual, but the transportation provider that gets the homebound, senior to their appointment, or the counselor that you can make available to the family caregiver. So aspirationally, that's the way we're really thinking about it. And like I said, this was, we've been building our innovation function and approach just the last 8 months as we've brought this organization together. But that's my corner of innovation at CMS, is really trying to develop those new approaches, partnerships, and services that are really going to help our provider partners deliver better outcomes.
So then the incentives and all of that has to change too, right? Because now you're incentivizing the physicians around the health and well-being of their patients, whether or not they follow the doctor's advice, right? You just hope that that we're as compliant as we can be in order to make the customer experience that much better, that they'll actually do what's asked of them.
Yeah, I think that's a really important point, because changing incentives is a piece of it, but I think we're in a unique position to not only change the financial incentives, but support providers in achieving in those realigned incentives. Right? That part of how we need to reorient our point of view is we have a responsibility to help support those providers, and there's capabilities and assets that we have that can be helpful to them, so that it's not just a matter of sharing risk, but really sharing support services as well.
Yeah. It's kind of fascinating, right? It's amazing how we got the like insurance cart before the horse in a way. At some point we
Right.
stopped checking in as to whether or not the patient was actually improving as a result of getting the care from a network of providers. And it seems to me like the union between Aetna and CVS is such a great driver for that push. I mean, the fact that you can't buy cigarettes anymore at CVS, right? There's a whole commitment to looking at the patient from the moment they step into anything that touches, quote unquote, the network, right? That
Right.
we're really thinking about the patient's well being top to bottom.
Absolutely.
Yeah. So a little bit of inside baseball because, so many of our listeners are chief innovation officers, folks with innovation in their title, product managers, customer experience, user experience driven audience here. So as you're thinking about what to innovate next, tell us a little bit about the decision-making process. You walked us through what you did at Wellpoint, but what's the decision-making process at NI? Is there like a portfolio of things that you're considering moving forward on, high risk, low risk? Are you more in the process
Yeah.
improvement like you were before? What's the shift?
It's a great question. So I think there are a couple of principles in the design, and these are things, lessons I've learned over the years and things that have sort of carried with me. But I think step number one in being able to make those choices and figure out which ideas, move on and which you pursue, the first thing is you've got to have a disciplined process for collecting, developing, and advancing those ideas, right? In my experience, the issue is at the end of the day, not a shortage of good ideas in the organization, but a real mechanism for, again, bringing them together and making decisions about which ones have the most promise and which ones best align with your priorities. That's sort of principle number one. And what we've set up with this team is set up a way to make sure that it's somebody's day job to do those things and that we have a real framework for making those decisions and that we have a real disciplined process for continually moving ideas through. At the end of the day, what we want to end up with is a portfolio of innovation opportunities that align to our strategy. So that's the other important part here is to not be innovating in a vacuum, but what we've done is to create our network strategy, which aligns to the enterprise strategy. And we've tried to distill that strategy down into a fairly concrete set of priorities that we can look at. And when we look at our portfolio, we actually dashboard it against those 15 or so things that we're trying to do across a couple of different dimensions. And the reason we do that is we want to make sure, we have a lot of different things we're trying to accomplish within this to enable the strategy, but we want to make sure that we don't fall into the trap of over-indexing on one, or at the same time spreading ourselves too thin. We realize of the 15 priorities we've laid out, we're spending all of our time on three, and we have dozens of ideas stacking up against the three. It really is very much a portfolio, but ultimately the decision about what to prioritize comes down to that. Does it fit against one of our core priorities? And then similar to what we were talking about earlier, having a set of objective criteria to say how attractive is this idea based on our priorities and how feasible is it for us based on our real world constraints and opportunities.
So, I mean, how often when you're setting out the timetable for this stuff, do you feel like you have an unlimited window to get this stuff done? Or do you give yourselves a discipline of finishing, with one of these products or processes along the way?
That's a great question. I think anybody working in this kind of work, you feel the pressure to get, your inventions out into the world. You want to see things succeed. And so a little bit of the approach, we try to make sure we slow down to speed up, right? So we use that, we time box the first part of the process so that we don't burn time on an idea that's not going anywhere. We quickly move on and go to the next one. And so we try to make it possible for ourselves to get these things out in the world by spending the time up front to cycle through and really make sure we have a sound hypothesis that we know we can test and then we know how to test and then move it along from there. That's really where we've put the point of emphasis. But I think that pressure's there every day. That desire, I shouldn't say pressure, it's really just the desire to you see these good ideas, you want to make them real. And we've got to enable ourselves to have the space to do that in an organized way.
Yeah. And senior management's on board with the innovation evolution?
Yeah, I think every organization desires, particularly large organizations, desires to enable a certain nimbleness and innovation. And so we've designed the process to really meet that need to allow us to move more quickly. I think the other important part is I talked about my corner of innovation. I'm only one part of organization with innovation needed in a number of areas. So one of the things we've done just by design is to recognize that and to create linkages with other teams that are going to be innovating in their corners and to make sure that we, and there's no magic solution to this other than coordination and communication, that we make sure that as we're developing our pipeline and we're developing and refining our priorities, we make sure we understand how they align with other parts of the organization that are also in the business of innovating, and that we're sharing that, and that we're, as much as we can, finding opportunities to bring ideas together that would be better served as, sort of a joint idea versus developed in different ways. And again, we're early in this process, but that's where we're putting our emphasis to give ourselves the best chance to get these ideas forward with the most impact, by creating those strong partnerships and in coordination with other parts of the organization.
So what's getting you really excited right now, the stuff that you're working on? What do you think has huge potential for success of what you're hitting on right now?
There's a part of me that's just excited, and this is not news to you because I'm a process nerd. I'm excited to see the innovation process actually move ideas forward faster. And because it's one of those things, I think one of the ways you can demonstrate value is just not just the idea itself once it gets out into the world, but if we can show that we can help the organization more rapidly advance compelling ideas, that is an important step forward. I get excited about that. And like I said, we're only months into that, and we're starting to see some traction there. I'm really going back to my first startup. I've always been desiring to do things that at the end of the day, the individual human being that we serve sees a difference in the way they experience our product. And, because this is a healthcare product, in a way that they can, live their life. And so I see a number of ideas in our pipeline that are really oriented around our core strategy of helping people maximize their health and wellness. And those are things that really excite me. There's lots of good things that we're doing, innovations around the way we conduct our business to allow us to do it more efficiently, to drive affordability. Those things are incredibly important. I personally I get more energized about the things that make healthcare more accessible and at the end of the day, more impactful. And a lot of that, certainly, that was, a lot of the work we did when I was in the federal government. There was a lot that I learned in that work that I brought with me here, and that still stays with me.
Yeah. So at some point, I hope to have you back where you can tell us, suddenly your insurance is not just going to be an app, but your provider will already know what's the best medication to recommend for you that has the greatest coverage. Or, are there ways of thinking about these things that as you're sitting in the doctor's office, you go, oh, all of this stuff is actually connected, and the doctor is connected to my needs as much as his own. I share this with you because it was probably about 3 weeks ago, my mom had developed 2 massive blood clots on her lungs. And she was in the cardiac ICU getting blood thinner. And the protocol, once you've been on blood thinners, off blood thinners, and need to go back on again, is to switch your medication. So that was the standard of care, and that's what happened. But I literally had to make 17 phone calls in order to get this new medication. And it was really pushing up. I was an hour and a half away from the moment where she had to take the medicine at 9:00 at night, and I still didn't have a prescription in my hand. And it turned out the physician wrote the prescription wrong. The difference in price was $47 versus $246. And so with the doctor having no means of knowing how it needed to be written in order to get the script right, so I could buy it at a reasonable price so that her insurance would actually do what it was intended to do. And so just looking at that was one day in the life of one emergent need, as opposed to other folks who are dealing with ongoing needs around this stuff. But I'm fascinated to see how it's going to turn out, because I think when doctors get closer to this process, we're not just forgetting about patient has to take pill, but patient has to get pill, find pill, pay for pill, all of those pieces that we might want to have a little bit more connection or alignment between the network providers and the patients.
That's 100%. Well, first of all, I hope she's doing better.
Oh, she's a powerhouse. She's out walking every day. My mom is 93 and she's unbreakable. So yeah, she's good.
I think you're exactly right. And this is where things like value-based solutions have been aspiring, and I think where we will continue to push, which is they are at one level realigning the financial incentives, but what they're realigning the financial incentives to do by design is to help create better coordination of care. And I think one of the things we see is, there are, and this is where I talked earlier about the support model I think we can bring, is that even when you realign the incentives, encourage better coordination, there are still things missing in that process that are necessary to make it possible to coordinate. And so that's where I think there's tremendous opportunity for us to plug some of those gaps to help a provider connect, for example, to a family caregiver somebody's helping their mother navigate that process.
Right.
So I think you're right. And I think that's what the direction things are pushing in. But there's, I think, so much more opportunity for us to improve there and to invent there.
Yeah. Well, if you need an earful, I just went out for tacos with 3 girlfriends last night who are all primarily caregivers to their aging parent. And it's a lot. I couldn't believe it. I didn't think a blood thinner would be like as popular as, I don't know, the next cronut or whatever that is, right? That I had to make 17 phone calls to get a blood thinner. I didn't know it was running out like that. I didn't even know that that was a possibility, that a pharmacy could run out of a particular medication at any one point in time. Yeah. So that was a wake-up call.
And I think just from looking out into the market, there is a ton of amazing work and innovation in trying to plug some of these gaps with people focusing on caregivers, people focusing on aging population, people focusing on individuals with really specialized conditions. So there's a lot that we're looking at, monitoring, but I think this is a place where people recognize the gaps, and I'm really excited for what I think the next couple of years can bring.
All right, so let's talk about that. And once again, I'm talking with my good friend and super innovator, Eric Fennel, the Vice President, National Network Strategy, Innovation, and Value-Based Solutions for Aetna. So this is usually culminates in the time, Eric, where I ask people some very special questions about innovation. But before I do that, I'm very curious about the drum set you have behind you. Have you become a drummer since we were in college together? And does drumming allow you to let go of some of the frustration that comes with innovation? How does it work?
Well, you probably were witness to the one very average show that I played at Quad Rock circa 1989.
Who could forget Quad Rock, 1989?
Who could forget Quad Rock?
Who could forget?
Exactly. So, no, I say it's funny. I played growing up, and I played a little bit in college, but it's not something I stuck with. But it was not too many years ago. I was joking with a neighbor who was also picking back up the guitar about, it was time for a neighborhood dad band. And my wife overheard that conversation and called my bluff, and hence drums ended up back in my life.
Wow.
But it's been great because it's been fun to pick it back up. I play along with my daughter, who's been playing saxophone the last couple of years. So I would not call myself a drummer. That would be a very strong word for what I do, but it is a great relief in between Zoom calls to get over there. I just have to make a point to close the window so I don't disturb my other neighbors who are working at home also, but it's a lot of fun.
I just love this idea of like dad bods in the dad band, and like what other dad assumptions can we make? Like, I don't know, is dad cooking mac and cheese? Like, I don't know what dad is, but there seems to be a whole genre of category of dad doing just okay. We're just okay.
Yeah, exactly.
That's the bar we're setting for ourselves.
Yeah.
So let me ask you some of the questions that I typically put my folks on the hot seat for. So, greatest innovation of all time. What do you think?
That's a great question. I feel like you almost have to say the iPhone because everybody says it. But one of the things I've learned to appreciate is that there are many types of innovation. And this is something I picked up on. There's a model that really spoke to me early on called the 10 types of innovation. And now I can't remember who put that forward. But one of the things that helped me realize for the first time was that the reason the iPhone was so innovative was not because of the device. It was because it created a different experience, a different business model, a different financial model. Like there were all these fundamental components that made it, I think, one of the most significant. But what I've come to appreciate since that it wasn't just the fact that they created this pretty thing. It was the way it changed how you interacted with the world. And there are many other things that do that. That's just the one that comes top of mind. But for me, it's because of that reason. It's because it hit on, if you break it down into the components, it hit on 6 or 8 of those 10 types of innovation, all in one product.
Right. Like massive broad scale innovation, whether it's process, business model, finance model, sales delivery, user interface, all
technology. Exactly.
Yeah. I mean, just creating an app store alone is a giant business, right? That in itself was worthwhile.
Exactly.
Yeah. Okay. So greatest innovation of all time, innovation team you would love to be on, would have loved to be on. If you could join any innovation team, which one would it be? And I use that term loosely because they might not have thought of themselves as innovators at the time.
Could this be of any time period?
Anytime. It's up to you.
When I think about now the group, and I got to work with some of these folks who had been at Insight in its early days, working with Apple and working with even, like, I remember the work they did to create what became the Acela and the whole consumer experience around that. I got a chance to work with some of those individuals. And when I got the stories about all the things that they did that we never knew that they were a part of, and they were working on behalf of different companies, like the team that created the mouse. If I could go back and sit on that team, just looking at the diversity of things they did, everything from the mouse to the Acela Amtrak experience, that to me, it's just like that variety is fascinating.
Yeah, right. And the joys of working in a consultancy and an agency versus working within a company.
Yeah.
Fantastic. Okay. And what's the innovation that we're missing that we all wish we had? What do you wake up and go, God, someone should invent something for this?
The thing that creates 6 more hours in the day.
Yeah. I think that's a conversation with the big guy upstairs. I'm not sure.
Yeah.
Or we just have to reimagine time, which is entirely possible. If maybe we could just get rid of daylight savings time, and that would be great.
Exactly. When I think about like the things they're missing, I actually would go back. This is more in the realm of important innovations. And as somebody's been going through some challenges with my own aging parents, one of the things I think I see is that the burden of some of the things that don't work in our healthcare system are no longer falling just on the patients, but on the, and this has been true for a long time, but there is this cascading effect on the family caregivers and everybody else who wraps around those individuals that have need. And this is not just with aging populations, but with people with ongoing conditions. I think there's a real need for a reinvention of the business model of healthcare that allows us to support those things financially, in a way that would really impact people's lives.
The New York Times did a huge piece on this, and it was all about how much time a caregiver is forced to waste in the way the structures are set up and the constant calling and recalling and all this kind of stuff. And it's built into the system this way. So, well, we're going to leave it at your feet, Eric, to completely redo that. If you could get back to us within the next 6 months or so, we'd love to see the whole redesign of the healthcare system.
6 months-ish, give or take.
Ish, sure. Well, Eric, thank you so much for joining me today on Innovation Storytellers. I'm sure there's so many people in our listening audience in the healthcare space who are going to want to know how to do this and are going to want to connect with you. What's the best way to do that?
LinkedIn is probably the easiest way and the most direct way.
Fantastic. So if you'd like to connect with Eric, that's the way to do it. Eric Fennel, Vice President, National Network Strategy, Innovation, and Value-Based Solutions for Aetna. Eric, thank you so much for joining us, and we'll leave off singing the Dickinson school song for now.
Thank you so much for having me. It was an absolute kick to be here with you. Thank you.
Thanks, Eric. Take care. Now you might be asking, Susan, why innovation storytelling? Well, the truth is that an innovation story told well not only breaks down communication barriers so you can drive change and new growth, but it also helps other people remember and champion your work. And it propels your best ideas forward faster to secure you the runway, resources, and recognition you so richly deserve. In other words, stories are memory-making devices that significantly reduce the time it takes for you and your innovation to be understood. But like many leaders, you probably never got the memo that storytelling skills would be central to your success. Well, I've got some good news for you. It's not too late because I've got you covered. Whether you need an expert to come and speak to your innovation leaders, you need training in the art and method of innovation storytelling, or you just need the support and guidance of a consultant who can get you where you want to go in less time, visit www.susanlindner.com today to learn more and to set up a call to discuss your needs. I'm so looking forward to connecting with you and to helping you tell a great innovation story. If you liked what you heard so far, don't forget to subscribe so you never miss another episode. And leave us a comment. Tell us what you think of this episode. We'd love to hear from you. And if you didn't like what you've heard, just forget everything I've said.